The California Academy of Family Physicians presents the 2016 Family Physician of the Year Award to Dr. Jeffrey Luther. This prestigious award to an individual who exhibits the finest qualities of family physicians and who goes above and beyond in service to patients and community. Musician, chef, brewer, father, educator, husband, futbolista, family doc. These are words that describe my friend, Dr. Jeff Luther, your 2016 Family Physician of the Year. I thought I'd share with you some words that were written on his behalf to support his nomination. Dr. Sue Melvin writes, "Throughout his life and career, Dr. Luther has been a gentle lion." Jeff always brings his best self. Dr. Cindy Herzog writes, "Jeff is an example of all the things we family physicians have done right in the last 20 years. Second-year resident, Dr. David Tran writes, "His approach to teaching is, I see you all as intelligent young colleagues and you deserve to be treated with respect." His son Jacob writes about their work in Honduras recently, "In a short week, my dad was able to leave a lasting impact on both patients and future health professionals." Sue Melvin again, and remember we learned about stories this morning, and so Dr. Melvin wanted to tell a story in her assessment of Jeff. "On house calls with a resident, one of the elderly patients answered the door completely nude. Dr. Luther asked the patient if he would like to get his pants on, at which the patient replied that he was a nudist and did not want to get dressed. It is my understanding that Dr. Luther completed his visit with the patient remaining unclothed. He has a special gift of gracefully finding the special sacred healing space between doctor and patient. The naked truth is, I can think of no physician as deserving of the title Family Physician of the Year. Congratulations, Jeff."
To look up and see people standing. First of all, he did put on his underwear. And for those of you who know Ben Ha, who's a family doc in Bakersfield, it was his patient. Ben and I did the visit together, and Ben, who speaks with this lilting North Carolina accent at the door, said, "Sir, do you always go around naked?" And he said, "Of course, I'm a nudist." And that's how the visit started. Thank you for this honor. It's been strangely humbling since I was told I was going to receive it. And having seen the people receive this award before, I always knew this was one award I was never in danger of winning. And so in this month, I find myself thinking, were the previous winners, did they feel as unworthy of it as I do? There's a little imposter syndrome, I think, in all of us. We talk about it a lot in residency education. But I had a friend who, in college, whose primary contribution to my development as a young adult was a 5-month campaign to get me to say thank you when someone paid me a compliment, rather than brush it off and say, nah, nah, nah. And so in that spirit, I'm up here to say thank you. And so it got me to think about what brought me to a point where someone thought I should get this award. And the way I think about it, if you meet one family physician, you've met one family physician. But although we're all of the same tribe, each of us, our career arc is a little different. And so it got me thinking, and I'm not as my wife might tell you, I'm not an inherently introspective person, but it got me introspecting and thinking, what's my arc? Not that it's over, I'm not retiring, but what's it like so far? What's made a difference for me? And a few thoughts that I have to take my glasses off so I can see my notes. A few thoughts about what the difference has been for me. For me, it started by finding a niche and a calling. I was in private practice for a short time, and then I really stumbled over backward into my dream job, teaching residents. And honestly, I think my mother was disappointed because in her mind, I never asked her because we never communicated that way in my family, but I always assumed that in her view, this wasn't really what real doctors do, teach, you know, and so she loved that I was in private practice, 10 minutes from her house, and I'm leaving that to go into teaching, she wasn't so sure about, but it was the right choice for me. And it's finding a niche and a calling and something you're passively good at and trying to spend more time doing it. If any of you have done the Strengths Finder inventory of gifts, you know that you should try to spend more time doing what you actually enjoy and are good at and not the stuff at which you're mediocre. I've been in education since 1993. I've had a small role in educating 203 family medicine residents so far. That's a tribute to them, but your cumulative impact over time mounts, and I like being able to say that. It's going up to 211 in June when the new class starts. It's also meant accepting that I don't have to be perfect at everything or even good at everything. And I think in family medicine, we're attracted to so much and we want to do this and we want to do that. And we feel a little guilty if we're not doing inpatient medicine or we're not doing OB or we're not doing this element of practice. But one person doesn't have to be everything unless they're like Bob Wergen in a town where they need someone to be everything. Southern California, not so much an issue. Something that's made a difference for me, and this is advice I give new faculty. This is advice I gave Jay Lee when he first came on as faculty 7-8 years ago, which is say yes when possible and say no when necessary. We heard a little bit about mentors, and this got me thinking about mentors as well. One of my early career mentors was Steve Brunton, who a number of you know. He was the program director when I first started at Long Beach. And when I first started, like my first day or first week on the job, one of my fellow faculty took me to lunch and he said, "You're gonna love working here. Steve is great, he brings you so many opportunities." It was always the 7 deadly words when Steve would come at you with his Australian accent and say, "I've got a wonderful opportunity for you." And you never knew what that meant. And my friend said, he brings you lots of opportunities, very generous, but you can't ever say no. At least for the first year or two, don't say no to anything he brings you. And I thought, that sounds like singularly bad advice. So sure enough, Steve would come with all these great opportunities. He was very generous with his support. And I would never answer him right away. I'd say, "That sounds very interesting, let me think about that." And I'd give it a few days or a week and I'd come back and usually I'd say yes, and it was a great opportunity. Maybe a little scary, but good for me. And sometimes I'd say, "Yeah, I'm not feeling it, I'm not gonna do that." And Steve always respected it and went on his way and brought me another opportunity next week. So when counseling Jay as a young faculty, he didn't really have trouble saying yes to things. I had to encourage him. There was a time to say no, even when it meant saying no to me. Mentors have been important. I mentioned Steve as one. Sue Melvin, who talked about my naked house call. I shouldn't call it that. My house call to visit the naked man is another. Another of my current, and Sue's still a mentor, even though we've been together professionally for almost 23 years. Ted Quilligan, who's my Director of Medical Education, DIO, at my institution, is kind of one of my bosses, but also a mentor. His signature is on my diploma from medical school. Good Lord, how long ago was that? 32 years ago. No, 1988, 28 years ago. He's still working as the designated institutional official, the head of GME. He's planning to retire this fall around the time that he turns 91. And yet, to this day, he's someone to whom I can turn for advice for the wisdom that he's gained over a career of 60 plus years. And you're never too old to have good mentors, and mentors change and evolve over time. So I guess coming down to a few thank yous before I get off the stage. First to my wife, Nicole, of almost 30 years. Well, she's on it for 30 years, but we've almost been married 30 years. And my son Jacob, who surprised me by flying out from Boston for the weekend to celebrate with us. One thing they share in common is that they both make me want to be better than I am. To my fellow faculty and residents for keeping me up to date constantly, because I have to, and also keeping me humble because they like doing that. To my mentors over the years, from Steve to Sue to Ted, and this is this is not intended as a joke because you hear people say it at these events, but thank you to the Academy, not just for this award as much as it means, but because for 22 years, this has been an element of my career that has added immeasurably. The opportunities, the guidance, the leadership, the friendship, the community that I've received here is irreplaceable, and I wish every family physician in California could experience it as I have. So thank you for the honor. Thank you for giving me a place at this table over the years, and have a great day. Thank you.